I am Dr. Nitish Naik. I'm the Professor of Cardiology at All India Institute of Medical Sciences, New Delhi. I'm a clinical cardiologist and have interest in clinical cardiology, electrophysiology, and coronary interventions. A good night's sleep is essential for our health, especially cardiovascular health. Lack of sleep leads to many hormonal changes in the body. It leads to a lot of changes in our blood pressure, in our hormonal cycle, in our energy levels, and it can lead to hypertension over a period of time. Lack of sleep also leads to low motivation, it leads to depression, and it leads to anxiety. Therefore, it is essential that we get at least 7 hours of sleep before we begin the day. Otherwise, all these ill effects over a period of time are accumulative, can lead to poor health. Lack of sleep also leads to craving for food. You often indulge in binge eating and overeating that contribute to weight gain. And there are many other neuropsychiatric manifestations that happen due to lack of sleep, and therefore poor sleep is often associated with weight gain. Sleep apnea is a very important problem in the current day because of increasing weight gain. Because of weight gain, what happens is that the passages in our breathing tract become narrow, and there's also loss of muscle tone, and therefore when we are sleeping there is a collapse of these passages, and something called sleep apnea happens, in which the person is not able to breathe, and that is what is meant by apnea. And because it happens in sleep, the person suddenly wakes up, starts breathing normally, and the cycle keeps repeating itself. This has been associated with many health issues, including hypertension, heart diseases, and attention deficit disorders, and many other health issues. You're right that you always don't need to be obese to have sleep apnea. Sleep apnea can happen in otherwise unfit individuals as well. But most of the times it is related to weight gain. But there are many other medical conditions which can also contribute to sleep apnea, which is why it is important that a person who is having daytime drowsiness, who dozes off during work or while he's sitting in his car or sitting in his office, he should be investigated for sleep apnea. Similarly, a young hypertensive, a person whose blood pressure is not being controlled with drugs, these are some of the patients in whom sleep apnea studies need to be done. No, you see, if you are healthy, you should not be requiring to nap during the day. In the elderly, it's a different issue because in elderly, they have an altered sleep cycle, which often requires them to have a short nap during midday. But for most healthy adult individuals as well as youngsters, sleeping during the day is really not required unless it is needed because of overexertion or any other physical overactivity. But generally, if you have slept 6 to 7 hours during the day, you should not be requiring to nap unless there have been some other health reason requiring you to do so. Increasing use of mobile phones, including in the late evening hours, is a cause for sleep disorders. Sleep requires a quiet environment, and when your mind is continuously stimulated, even during evening hours, you may be unable to sleep. There are many thoughts that may come into your mind unconsciously, which may keep you awake. And therefore, it is not healthy to keep looking into the phone, referring back to the phone, looking at every notification that comes during sleep. And in some people, this can become disturbing enough to cause a sleep disordered lifestyle. In addition, looking to the phone constantly takes away many of the healthy stuffs that you can do. And it may lead to interrupted sleep, poor sleep quality, inability to wake up in the morning and do many other physical activity which you should be indulging in rather than looking into your phone. Well, all I can say is that the human body is quite incredible, and during periods of stress, during periods whenever we are required to perform, we can certainly work a lot and we may be able to do with very less sleep. But when this is done on a constant basis, what happens is that it causes some harmful effects on the body. See, the body also needs some rest. Sleep is a cycle that has been determined by biology. Your body has worked throughout the day, and when it has worked throughout the day, your body needs to, again recoup its injury and get back to be in shape for the next day. If we are constantly fighting against our body, against what is considered a normal physiological pattern, then we are not giving adequate rest that the body deserves, and over a period of time, this sort of abuse may result in health problems. So people may be able to do it, and they may be able to do it for long, but would it be considered completely healthy? I wouldn't be so sure of that. Be healthy, eat healthy, live healthy. Don't take your worries home. You should live your life.